Did you know your baby is going to have to actually pass their first few tests before they ever leave the hospital? I'm not talking about a paper and pencil, but yes, I am talking about a couple of important tests, labs, and screens that we do before your newborn ever leaves the hospital. Stay tuned and find out more. Hi everyone, I'm Dr. Amna Husain, board certified pediatrician, board certified lactation consultant, and mom. Today we're going to be talking about what to expect in those first few hours to days after baby is born before you leave your birthing center or the hospital. Now generally right after baby's born, of course, nursing team, doctors will assess the baby, make sure everything is okay, do an exam, listen to the heart, the lungs, and they're going to have you definitely try to nurse baby if you are interested in nursing. Or at least feed baby in some way so we can kind of get baby nice fed, get those glucose levels up. But generally, what are some tests that we do for every newborn before they leave? First up, a weight check. This is really important because you may not know this, but babies actually lose weight in the first few days of their life. This is something we completely expect. We actually consider it due to some fluid shifts. So obviously baby, when they're pickling inside the amniotic fluid, it's very different than being exposed to outside air and then really being able to maintain their temperature in other ways. So we actually do see some degree of weight loss, up to 10%. Somewhere beyond that is something your pediatrician might want to investigate further. So we do keep an eye on how baby's weight loss is doing. The second thing, a hearing screen. So you can opt out of a hearing screen. I don't necessarily recommend it, but I do see some families opt out of it. A hearing screen is really nice because we can screen for baby's hearing before they ever leave the hospital. Audiologists oftentimes are the ones to perform this exam, and they're able to do it on a few babies the day before they leave. And sometimes they can fail because be amniotic fluid in the canal. It could be all different types of reasons why a baby might fail their hearing screen, but we can repeat it beforehand. The third test that your baby might receive is a bilirubin screen, or screening for jaundice. If you've never heard that word before, I definitely recommend you check out my video, What is Jaundice and What Does It Mean? We've talked a lot about jaundice in the past, what it means, what it actually does in the body, and how to get rid of it for a baby and when it's problematic. That whole process of screening for bilirubin elevation or jaundice levels in the baby actually begins in the hospital. This is going to be another lab that checks out for your baby. Next up, a newborn screen. So a metabolic screen, a newborn screen, you might hear it called a PKU in some states or some hospitals, is a screen for metabolic disorders. This is metabolic disorders, but also electrolyte imbalance disorders, congenital disorders that could be devastating if missed in infancy. So some examples are PKU, congenital hypothyroidism, a fatty acid profile. So trying to understand if there's anything that could be on the metabolic level affected for your baby, and we'd need to know ASAP. Usually this test comes back after being sent to the state lab within 10 to 14 days, and your outpatient pediatrician would receive those results. Sometimes the hospital gets the results and then they try to fax them to the pediatrician, but this is a really important lab that you have to consider, especially when you're looking at your newborn's health, because sometimes these babies can seemingly appear totally healthy and then begin to act very funny a few days later, few weeks later, and it's super important to understand and have these results in hand so that you can treat them or get them into the appropriate therapy beforehand. Last up, let's talk something that we call in the hospital eyes and thighs. So let's start with eyes, erythromycin eye ointment. So you may have seen or heard of this when it comes to babies and them getting an eye ointment during the time of delivery. Now, typically, this is an antibiotic topical eye ointment aimed at helping to prevent bacterial eye infections that can occur during the birthing process. Next up, the thighs of eyes and thighs. So this commonly refers to the vitamin K shot. Now, this is an intramuscular injection of vitamin K. It's super important to understand the purpose of this vitamin K, especially for newborns. So this is to prevent hemorrhagic disease of the newborn, because vitamin K plays a very critical role in the clotting cascade. And lastly, one other thing that can fall into eyes and thighs is the hepatitis B vaccine. Now, typically vitamin K is given very early. Hepatitis B can be given on the same day of birth. It can be given a few hours afterward. It can be given the next day. It can be given right before discharge. But we do like to give hepatitis B vaccine as well. Now, the hepatitis B vaccine for newborns is aimed at helping to prevent hepatitis B infection. Now, newborns can become infected with this virus, the hepatitis B virus, if their eyes, nose, or mouth comes in contact with any secretions of the parent's blood or the mom's blood during the birthing process. Now, why do newborns need to get the shot? Because they have a 90% chance of developing liver cirrhosis, which can lead to liver cancer and be fatal if you contract the hepatitis B virus during infancy. So there you have it, the 5 tests that your newborn is going to have before they leave the hospital. Weight check, bilirubin, hearing screen, a newborn screen, and then eyes and thighs. Sometimes, if you're extra lucky, like I was with my oldest, you might even get a car seat check as well, especially if your baby is a little bit on the smaller end, because we want to make sure for safety reasons that your baby fits well and snug in that car seat. If this video was helpful, give it a thumbs up. If you have any questions below, just ask them and I'll try to do my best to answer. I hope to see you guys next week. Bye.